My name is Abby Penn Adams Arthur, and I'm here today with Nicholas and Matthew. And I'm very excited to have a conversation about, Nicholas, your health journey, and Matthew, how you help folks with medication adherence as a pharmacist. So Nicholas, you shared earlier a little bit about when you were diagnosed with diabetes. Can you tell us a little bit about how you found out you were diabetic?
It was something my PCP, because I was overweight, they said maybe you should get checked. So when I was first checked, it was pre-diabetic and I was active. So I was like, okay, it's fine. Just keep at it, because I was type 2 diabetic. And I do have family members that are type 1. So
You have family members that are type 1 diabetic and type 2?
I'm the only one in my family that's type 2 diabetic.
Okay, everyone's type 1.
Yes.
Interesting.
So I'm not insulin dependent, which is a good thing.
Yeah, definitely.
But yeah, it's when I thought it was manageable because I had a shift from where I used to live to where I moved to. I slacked up on my insurance, so I didn't have a PCP. And then when I really needed something, you find out like, oh yeah, so yeah, you're no longer just pre-diabetic, you're full on. And that was a nice overnight hospital stay because they had to monitor me because my sugar was really high.
Oh my goodness. So you went from being someone with metabolic syndrome or like pre-diabetic to, and managing that, right, because you were active, to pretty much quickly learning from a lovely hospital stay that you were diabetic. You mentioned earlier that the biggest reason why you personally wanted to join Scene Health was because you wanted help with your medications. Can you tell me a little bit about what was happening before? Like, what was the thing that like prompted you to say, you know what, I need help, I know I need help. What is something out there that can help me with my meds?
So one of the things I was dealing with was literally just, I would look at the medication and be like, I have to do something. And then it will go past my mind and I won't remember it at all until like 1, 2 o'clock in the morning. I realize, oh wait, did I take my medication?
Got it. So you'd like wake up in the middle of the night and be like, oh, did I take my meds?
Yeah, and again, that's the aspect of being as diabetic as I was, and insurance have me being more monitoring with my my sugar levels. If I don't take it, it's very high, and if it's very high,
It's
they
impacting
probably
your
need.
health.
Yeah.
Okay. So it was really like forgetting your medication or missing doses were really creating life distractions for you, but it was creating fatigue or creating literally more problems with your diabetes because you were missing your meds.
Yeah.
What changed for you once you decided, okay, I'm gonna get on, you know, did they give you a range of options of what you could do? What did they say? Well, you could get a pill box that rings, or you could put an alarm on your phone, or you could, like, when did somebody tell you about Scene, and what did they say?
So surprisingly enough, I got into Scene because it was an ad.
Oh,
I was
okay.
reading a book online and it popped up.
Okay.
And it was stating, hey, do you want to help manage your diabetes and
Okay.
whatnot? I was like, sure, I'll do that, because again, the whole aspect is, if I'm not managing it, I'm hurting myself. And if I'm hurting myself, and one of the reasons why I said I really wanted to make sure I manage it, it's, I lost time with my daughter. So I have my grandnephew, grandniece, and my newest grandnephew, and I was like, I want to be there for them.
Yeah.
So I got to manage my health. I got to make sure, even if I'm not able to walk, I'm going to be in their life as long as possible.
Sure.
So when it's saw what are they doing and then making me accountable, that I'm not just going to say, oh, I did and I didn't do it.
Yeah.
They made sure that I have to show I did it and do it.
So it was like you were scrolling through, reading something, saw a flash ad that says, hey, do you need help managing your diabetes? And you were like, huh, click. And that, like, something about that and the moment in time in your life, both of those things made you really realize this is a perfect time for me and I think this might help me. So what changed for you once you started the program?
As I said, it's
Was it immediate? Like, was it like you started and all of a sudden you realized quickly this was going to help you?
it was that it was immediate, but it's the aspect of as an adult you lie to yourself quite easily.
Okay, all right.
So it's, as I said, it makes me be accountable for my own things.
Yeah.
So it's as I started to, like, by the second week, I was like, okay, I have to carry my medication with me, even if I'm like, oh, I'm gonna go outside. It's have it with me, have something so that I can't make the excuse of, oh, I don't have it, so I didn't take it. Oh, I don't have what I need to take it.
Okay.
And that to help me be moving forward. Make sure, have it, be accountable, make sure that I can't say, oh, well, something happened, I didn't take it.
Got it.
If I didn't take it, that's on me, and I have to remember every time I miss my medication, it's a hospital visit sooner.
Yep.
That is time away from what I want to be able to do.
Got it. So it took you about a couple weeks to like just get in the groove, kind of be like, okay, wait, this is on me. I have to be accountable. This is what I said I wanted to do, right? And so I gotta kind of do this for myself, right? All right, Matthew, tell me a little bit about yourself and what your role is at Scene Health.
Well, my name is Dr. Matthew Macias. I'm a clinical pharmacist at Scene Health. Fairly new to the company. I've been with the company for about 3 months now, but I've been a clinical pharmacist for about 4 years, and I've worked in various areas within pharmacy. I've done retail pharmacy for Walgreens, CVS, worked a little bit with insurance companies, doing mail order pharmacy, also working on prioritizations. So I kind of got a good glimpse of how the pharmacy world works, both from the patient's perspective at the pharmacy and also from the insurance perspective.
So you know front end, you know back end, you know the customer service side, but you're also probably a patient yourself, right? You take your own medications.
Exactly.
You know what it's like to be on the other side of the window per se, right?
Exactly.
Okay.
Yes.
So why something like Scene Health, and what do you do when you're at Scene?
So at Scene Health, one of my main duties is doing what's called a comprehensive medication review.
Okay.
So that's where I will I'll call a patient and I will talk to them. We'll go through a rundown of all their medications, and we'll discuss what the medication is being used for, making sure they understand how to take the medication properly, anything that they may want to keep in mind as far as side effects and things of that nature. And it's also a time for the patient to talk about any concerns that they have, if they're experiencing any side effects, if they're having any issues with their medications. It's a time for us to talk about that too, to see if we can address it by fixing small behaviors, like maybe taking it at a different time of day, or if it's a bigger issue, then that's where we can then reach out to the doctor and see if we can switch things up, whether if it's a dose change that needs to happen or changing up the medication.
So you're kind of like a pharmacy Sherpa.
Mm-hmm.
You're a translator in some ways, right?
Yes.
So you've gotten a chance to meet someone like Nicholas.
Mm-hmm.
Nicholas says, you know what? I found this ad online. I clicked the thing. I know I need to start managing my health better because I've had a few things where I've had to, every time I'm not managing things well, I'm either sick, right, and I'm not feeling well, or I end up having to, on the worst case scenario, go into the hospital. I'm tired of these unnecessary hospital visits, right? So how do you, help someone like Nick, who, comes in with habits, like he's missed a few doses here or there, or like you mentioned, like, oh man, I left the house, I don't have my pills with me this time, or next time I'll have to do something a little bit different. How do you help them build a more kind of consistent medication routine from a pharmacy standpoint?
So I think it really it starts off with education, just making sure the patient is aware of why they're taking their medications, how to take them properly. Because I think if the patient doesn't understand why they're taking these medications or what the purpose of them is, then that is already going to start off. That's going to lead to bad habits right there.
Yeah.
And just helping the patient to understand the medications better, and simple things like helping a patient to understand that it's better to take your medications on a consistent basis rather than taking them at different times on different days and skipping doses. Having that consistency is going to help to prevent issues down the road. And I think just helping the patient understand that's the first step to building better habits.
Got it. So Nick, you shared that like physical pain and mobility issues have made it hard for you to even kind of deal with all of your multiple doctor visits. And you mentioned like you actually have multiple doctors. Like,
Yeah.
So you've got one doctor for, one chronic condition. You have another doctor for, your gout, and another doctor for your diabetes. And so it's like many different doctors, and sometimes they don't even talk to each other. What has been the most frustrating part about accessing care?
So, because my issue is mobility,
Uh-huh.
literally, I have to be extra careful with, hey, I'll take up a doctor and I'll have to ask, hey, do you guys have wheelchair on location?
Yeah, do you have a wheelchair on location? Do you have wheelchair access?
Something that's once again just in the winds with insurance. But it's a lot of times it will be, oh, we have or we don't have it in the size. So I'll like, okay, I can manage with the walker if it's a short space.
Okay.
But it's never just a short space.
It's never a short space. Okay.
And you can imagine if you have a mobility issue stating, hey, I can't go that far, and every time, hey, doc, can you? Oh, yeah. And it's all the way at the back of the building or the back of the office. It's just, I don't want to go because it hurts.
Yeah, sure. Yeah, like exacerbating your actual pain
Yeah.
to actually go and see the doctor for the pain.
Yeah,
So creating pain to go see the doctor for the pain.
very much
So going to see the pain doctor and creating more pain to see the pain doctor.
You can see the conundrum.
You also mentioned that even when you explain your limitations, right, the provider still says, well, please come in. Like, we need to see you. How does that impact your motivation to stay engaged?
I kind of check out most of the time.
Yeah.
It's the whole thing about it. I have enjoyed the aspect of telehealth,
Okay.
but the whole caveat with telehealth is certain things should work, but I've had providers say, "Hey, we need you to come in,"
Yeah.
but I can't. Well, we can't continue certain things unless you come in.
Got it.
It's like,
Yeah. It's like a catch-22.
yeah.
We want you to use telehealth to manage your care, but then if you don't come in, we won't allow you to use telehealth to manage your care. Okay, great. So Matthew, this is like a perfect storm, right? Where you see someone like Matthew who has multiple medications because he has multiple doctors, but those doctors don't speak to each other. So he's got medication A from a pain doctor, medication B from a diabetes, and medication C from an endocrinologist, and medication D from a pain specialist, and medication E from, another specialist who's helping him with his arthritis. How do you help people who have multiple medications with multiple clinicians that have different expectations? And how do you keep them motivated? How do you help them, how do you reach out to these multiple clinicians? How do you help educate, someone, like Nick? And when can you help, directly support and advocate for him? How do you do that?
So at times it can be a little bit challenging, but I think the best way that we can support patients that are in that kind of predicament is to provide one of the parts of our program that we provide, which is called linkage to care. And I think that's really important because a lot of times, like you said, the patients go to many different doctors, they don't communicate to each other and are not on the same page. So the linkage to care kind of helps to link all those pieces of the puzzle together so that it's a clearer picture for the patient, and also so the doctors can start communicating with each other, making sure that they understand which medications the patient's taking, what conditions are being treated by which doctor. So I think just helping the patient to connect all those doctors and making sure that we can reach out to them, making sure that the patient is getting the care that they need, and making sure that they understand why they're going to this doctor or why they're going to that doctor. I think that's the best way that we can support them, is just helping them to link all those pieces together.
And how do you seeing like filling in that interstitial space, those gaps in between, especially people, like Nick, who need more flexible understanding of the healthcare system? Like, mentioned earlier, he doesn't even really have all the things that he needs. And, he needs like support, navigating, just even like referrals sometimes with insurance. Like he's waiting on a piece of durable medical equipment that he needs to actually go to all of his doctor's appointments, right? He needs a piece of equipment, or he needs something specifically. Are there any other stories like Nick's that you could share where you guys are using these linkages to care to really advocate in some ways on the insurer to really make the system work?
I can think of a lot of different scenarios where patients need certain devices or certain pieces of equipment to monitor their health. And it could be as simple as a blood pressure monitor to make sure they're checking their blood pressure regularly, or a glucose monitor that they can use to check their blood sugar levels. And that is a topic that comes up a lot when I visit with patients, is just making sure that they have those devices that they need, or somebody with mobility issues having a walker or a wheelchair that they can use to address those needs. And I think it's just really important to be there to listen to the patient, to not only be a clinician and educate, but also be able to step back and listen to the patient and listen to what their needs are, so that you can better address those needs.
So Nick, you talked a lot about using Scene and using the check-ins with the health coach or even with the pharmacist to be more honest with yourself. And you said something that I really had to kind of laugh at internally with myself, which is as adults we can lie to ourselves.
Yes.
Right? What does that kind of support, being more honest with yourself? What does that feel like to you?
So the whole aspect why I say adults could easily lie to themselves, because I could just say, oh, I'm in perfect health, I don't need anything. But that's a lie. I know I'm diabetic, I know I have high blood pressure, I know I have arthritis. The whole aspect of why I would say it makes you accountable, it's if you know you have this and you're not like, oh, I don't need it, you pursue the right medication, you pursue the right doctors to make sure I have something to manage it.
Yeah. What are some of the most meaningful moments from the check-ins that you remember? Any small wins or conversations that have stuck with you?
One of them was in December. I was having an issue with my PCP, one of the medications I needed, and they were telling me, hey, you gotta come in. I was talking to, not well, but it was one of the pharmacists, and they were able to bypass the doctor to say, hey, this is needed, and I was able to get an extension of what I have. Okay. So that at least I wasn't, twiddling my thumbs being diabetic without my diabetic medications.
Yeah. Somebody really advocating for one, it's the holidays, it's very difficult to get in, you've got mobility issues, and it's just challenging, right? Having someone advocate on your behalf. Yeah, it's really important. What helps building a strong relationship between a member like Nick and someone on their care team like another pharmacist or a coach, or even what builds a great team between a pharmacist like yourself and the other side of the care model, right? Like a clinician on the other side, like a PCP, or even maybe a member of the insurance team.
I think the most important thing is kind of going back to what I talked about previously, just the communication aspect. Because I feel like a lot of times the reason that there's these gaps in care is because different care teams are focused on their main goal, but they're not focused on talking to each other and understanding what the patient needs as a whole. There's not as much collaboration as I feel like there should be. So I feel like just having that mindset to collaborate and communicate both with the patient, internally with our team members, and also with external parties like the insurance or one of the doctors on their care team that's external. Just having that open line of communication, so that we can make sure that we're putting the patient at the forefront of what we do, rather than focusing on individual goals here and there, and just focusing on a goal for the patient altogether.
Yeah. Nicholas, you've talked about like trying to like these cyclical patterns, right? Like trying to lose weight to help with your pain, right? But also the pain makes it hard to move.
Yes.
Right? What is that cycle like? Right? Like it seems like a very frustrating cycle.
So let's put it this way: on any given day, I would love to say, let me get up, let me do a little calisthenics. But to get up, I'm in pain. Can't do much. But I have to sit. I can't move. Contact, hey, I need this medication. Well, I need you to go here. But I can't go here. Well, you can manage. You can do it. You just have to move. But if I move, I'm hurting. But I can't move. So I'm stagnant because I'd like to move because the pain prevents me to get the medication. To help with the pain, I have to move.
Yeah. How do you work with people who want to improve their health but can't follow like typical or traditional advice? Like just like this, like exercise more, or I mean, someone like Nick, can't follow that because of pain or other limitations.
I think the important thing to do is whenever you're talking to a patient, you have to see, you sometimes have to think outside the box, and you have to think of things that you wouldn't typically think of right away. Like you said, just as easy as telling somebody like, oh yeah, just go take a walk around the block or go exercise. But not everybody has that ability, so you have to kind of tailor your recommendations to the patient that you're talking to. So like if for someone with mobility issues, you might have to suggest other options like like pool therapy, where it takes pressure off the joints, pressure off the limbs, so that way that person can still have some the ability to exercise, but also still protect their their joints and not cause them more pain. So I think it's just trying to individualize your recommendations according to what's best for the patient.
Yeah, what does progress look like when you're not like measuring numbers on a scale?
On a good day,
Yeah.
just being able to get up, be with my grandniece and nephew, and not just be in a corner crying on the inside because I'm just depressed. I can't do nothing.
Yeah, sure. Kids always make things. Sometimes they make things better, right? Sometimes. What does it really take to sticking with a health routine when life feels unpredictable or overwhelming?
As I said, it's when everything hits you and you just don't want to.
Yeah.
It's just knowing if I don't do it, nothing's gonna help, and I'm gonna end up putting an extra foot in the grave faster and faster if I don't do it for myself.
Yeah. Well, I so appreciate you giving us so much of your personal story. It's such it's an honor to get an opportunity to hear from you, but also to be encouraged. And I know so many other people deal with many of the things that you are battling. And thank you for taking time today to deal with the pain, right? To come and spend time with us today. Because I really do think that so many people will be encouraged, kind of like I am, and I'm certain you are as well, hearing about your story and how your motivation to kind of save your own life and to manage your own diabetes and your other conditions have really done exactly what you just said, right? Keep you further and further from the grave, and keep you here, not just for your grandniece and nephews, but their children as well.
Yeah.
So I appreciate your time. Thank you both.